Okay. Hello, this is my extra credit assignment for AMP1. It's on Lyme disease. The etiology of Lyme disease. Lyme disease occurs when a Aedes tick infected by a bacteria bites a human. In North America, the bacteria that causes Lyme disease is Borrelia burgdorferi. The bacteria is originally transferred to a tick when a tick bites a small rodent, which is carrying the bacteria, which then bites a human. The symptoms of Lyme disease come in three stages. Stage 1 is known as early localized, which occurs within days to up to 1 month after the tick bite. Characteristic symptoms of stage 1 include the erythema migrans rash, which is often bullseye shaped, although sometimes it is not, and in 30% of cases the rash does not develop or is not noticed at all. Fatigue, malaise, lethargy, and joint fatigue, malaise, and lethargy, which can feel like the flu. Migratory muscle and joint pain, meaning it will affect different places on the body on different days. Loss of appetite, swollen lymph nodes, and fever. Stage 2 is known as the early disseminated stage, which occurs weeks to months after the tick bite. Characteristic symptoms of stage 2 include more than one EM rash, pain that comes and goes around different parts of the body, in joints, tendons, muscles, and bones. Meningitis, which is an inflammation of the brain and spinal cord. Numbing or tingling in the arms and legs, which is known as radiculoneuritis. Weakness or drooping on one or both sides of the face. Difficulty closing eyelids, which is known as facial palsy. Carditis, which is an inflammation of the heart, which can cause a number of symptoms, including shortness of breath, fainting, and irregular heartbeat. Stage 3 is known as the late disseminated stage, and occurs months to years after the tick bite. Symptoms characteristic of this stage include arthritis with joint pain, which may be constant at this point, concentration issues such as brain fog, as well as difficulty remembering, nerve pain that may feel like a tingling numbness, burning, or stabbing in the hands and feet, which is known as peripheral neuropathy, neuropsychiatric issues such as anxiety and depression, difficulty falling asleep, staying asleep, or getting refreshing sleep. So, prognosis of Lyme disease. The prognosis for patients in the early stages of Lyme disease is very good, but as the disease progresses without treatment, the prognosis worsens. Deaths from Lyme disease are extremely rare. As time passes, though, the risk of developing post-treatment Lyme disease increases, uh, with some patients even developing post-treatment Lyme disease after receiving early diagnosis and treatment from Lyme disease. Post-treatment Lyme disease is when patients have persisting symptoms of Lyme disease 6 months or more following the treatment. Post-treatment Lyme disease can be debilitating, as you can see with some patients experiencing extreme fatigue, joint pain, and difficulty focusing and concentrating with post-treatment Lyme disease. So the treatments for Lyme disease are antibiotics. So doxycycline, a tetracycline antibiotic, will stop the bacteria from reproducing. Uh, Penicillin family, amoxicillin can be used. The second generation cephalosporin Septin can be used. These disrupt the cell wall of the bacteria. Generally, oral antibiotics are used, but in later stages, intravenous antibiotics may be used. Antibiotics are crucial because, as I said earlier, as the disease progresses, the risk of developing post-treatment Lyme disease increases, and if you don't get antibiotics, the disease can not resolve on its own for a very long time. So the relation to AMP1, there are a number of symptoms that we discussed here that are very related to AMP1. Lyme arthritis. Lyme arthritis is swelling and pain in the joints. Recall the synovial membrane lines synovial joints. Synovitis can occur, which is a swelling of the synovial membrane, which can cause pain and stiffness in the joint area. This is the result of an immune response in the bacteria, which can persist post-treatment due to parts of the bacteria remaining in the joints, continuing to trigger an immune response. Lyme disease can result in Lyme carditis, as I said earlier, which is the result of the spread of the bacteria Borrelia burgdorferi, which can affect the heart in a number of ways. Recall how pericarditis is an inflammation of the serous membrane of the pericardial cavity. Pericarditis can occur due to an invasion of the pericardium by Borrelia burgdorferi, causing an exaggerated immune response. Heart muscles should beat in a rhythmic pattern, controlled by electrical signals called action potentials. Uh, these action potentials are passed through cells through intercalated discs. Lyme carditis can cause communication problems in the electrical signals past the heart, resulting in a dysregulation of the rhythmic pattern of the heartbeat, resulting in a slower than normal rhythm. This is called atrioventricular blockage, which can be life-threatening. We discussed how neurons send action potentials to control muscle cells. Facial palsy occurs due to an invasion of Borrelia burgdorferi into the brain, causing swelling in the cranial nerves, inhibiting neurons from sending these action potentials to muscle fibers. We discussed how the immune system fights bacteria and will mobilize an immune response. This is done in the lymph nodes. So when Borrelia burgdorferi is being fought, an immune response will trigger a swelling of the lymph nodes, which more with more cells, blood cells flowing to the lymph nodes. This is my works cited.